The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, welcome to DDA Educational Series. Today is Tuesday, March 19th, and we have applying for the DDA services and eligibility determination topic today. So I want to welcome everyone, and just to let you know, this session is open to all stakeholders. It'll be about an hour, and it will be recorded so that if anyone wants to review it later on, they can do so. We have Q&A through the chat box on the panel to your right. You can type in your question and we'll be able to answer that for you. Just so you know, everyone will be in listen-only mode and everyone is muted. Let's see what else. I think that's about it. Okay, so let's begin. And I'd like to introduce Patricia Sastoki. She is the DDA Director of Programs. Hi, Patricia. Are you on the line?
I am. Hi, Donna. How
Hi.
are you?
Thank you.
Thank you, everyone, for joining us today. Today is the beginning of a series that DDA is doing, and hopefully to be able to engage with families, people in services, providers, new, old stakeholders about DDA. And so we have a series of the trainings throughout this month, and we're just very excited to launch this. And since this is the DDA Awareness Month, we thought it was a great opportunity to do this. We want this to be very short and sweet, and we also want to open up for Q&As. And with me today with this presentation, I have the Director of Federal Programs, Rhonda Workman. So we're going to get started. The first slide that we have is just telling you a little bit about what today looks like. And we're just going to do an overview. We're going to talk about eligibility versus entitlement. We're going to talk about how do you apply for the DD services. And then we're going to open up for Q&A. So one of the things that we wanted to talk about is really what we're about. And we believe that all people have the right to live, love, work, learn, play, and pursue their life's aspiration in the community. This is very important to us. It's not just words on a screen or on a paper, but we really believe and we really want to make sure that people have these opportunities and a trajectory to their good life. We partner with people with developmental disabilities and their families to provide supports and resources to fulfill their lives. We ask questions to families. We ask, is our system working? Is it not working? How do we improve it? And as we do that, we tweak services, definitions, amendments. So we really do believe in this. We provide a coordinated services delivery system to enable children and adults with intellectual development disabilities and families to work towards self-determination, interdependence, productivity, integration and inclusion in all facets of life. So what does that really mean? So we have some 5 focus areas within DDA, and that is self-determination, self-direction, supporting families, housing, employment. And so as we look at all of that, we want to make sure, how is the person in services able to really determine supports and services? How do we empower people? And how do we make sure that people are being interdependent? You know, we are not all fully independent. We're all always connected to something. And then how do we make sure that we are moving towards that integration and community involvement across lifespan? We are one of many, many resources available in the state of Maryland to support people and families with developmental disabilities so that they can create a good vision of whatever and how they define a good life. And so those are like critical, I think, fundamental principles that we believe in, and we wanted to share that with you today. Also wanted to tell you that we not only just serve adults, but we serve children and families. So we really provide service through the entire lifespan. And whether you came to DDA before and they told you we didn't serve children, well, they were wrong. We serve children and adults and families. We even serve families because the way that how we define a family supports waiver, it really is not just for the person, but also for families. My next slide just shows you a little bit about, hey, where are we? So this here is pretty much where we are located. Across the state, we have 4 regions. We have one in Central. Right now, we have an acting director there, Michael Bryan. We serve in those counties in the Anne Arundel, Baltimore City, Harford County, and Howard County. So those are the folks that if you are in that area, you then belong in Central, and your lead person is Mr. Brian. We also then have Eastern Shore. Our director there is Kim Scheidel. And those serving counties is Caroline, Cecil, Dorchester, Kent, Queen Anne's, Somerset, Talbot, Wacomico, and Worcester counties. And I say that because sometimes people say, oh, am I in Southern, am I Eastern, or where do I go and who do I go to? So this is just at a glance review. We have a director in the Southern region, Judy Paddock. That region serves Calvert, Charles, Montgomery, Prince George's, and St. Mary's counties. And in our Western Maryland section, we have Kathy Marshall, who serves the Allegheny County, Carroll County, Frederick County, Garrett County, and Washington County. So those are the counties that we provide services. And then so we want you to see who they are, what counties we serve, and then the contact phone number. In the event that you have any questions, concerns, or anything, as we get into talking about DDA eligibility versus entitlement, and how do you complete the application, and where do you find those resources. So I'm going to turn this over to the Director of Federal Programs, Rhonda Workman, who is going to then share a little bit about our eligibility versus entitlement.
So good afternoon, everybody. It's a pleasure to be able to share this information with you. So before we get into our application process and our eligibility categories, we just wanted to share a little bit of information about the differences between eligibility versus entitlement. And so in the state of Maryland, students are entitled to education, to include special education, free appropriate public education through the year in which they turn 21 years old under the Individuals with Disabilities Education Act, or if they have met the requirement for their Maryland High School diploma or a Maryland High School certificate of program completion. So in the state of Maryland, education is an entitlement, and therefore services are available to people who meet those criteria. Once a student exits the school, however, he or she must meet specific eligibility criteria and the potential of funding availability in order to attend post-secondary education and or to receive services through adult services agencies or programs, such as the Developmental Disabilities Administration. So for us, the DDA services are provided based upon eligibility for services and are not an entitlement. So we look at eligibility and the availability of funding to support people. So before we get into, again, our application process, we just wanted to share that, as Patricia said, we're only one of many resources available to people in the state of Maryland. There are a variety of different services and programs, locally, county, and Medicaid type programs, disability specific programs, and we've listed a few of them here on this slide. That would include our early childhood intervention services available through the state of Maryland, Medicaid's Community First Choice program, which is a service that's available through the Medicaid state plan and includes a variety of waiver-like services. There are other waiver programs in addition to the DDA waiver programs that we'll be talking about in April for our webinar series. Other waiver programs that may meet some needs include the autism waiver and the model waiver. There are also programs available under the Department of Human Services to include respite programs that may be able to help families. And the Maryland Department of Disabilities also has a program referred to as the Attendant Care Program that can provide some personal care, attendant care type supports for adults in the community. And as I mentioned, there's other local, county, and federal programs that are also available. In addition to the waiver programs that we'll be talking about in future weeks about our service systems, the DDA also administers a program referred to as the Low Intensity Support Services Program. We refer to this as LISS, L-I-S-S. This program is a very flexible program that does not require individuals to meet the DDA specific eligibility criteria that we'll be talking about in the upcoming slides. The basic eligibility criteria for this program is for the person to be a Maryland resident with a developmental disability, and the types of services that would be available could be things such as assistive technology, respite, environmental mods, childcare, special equipment, things that are based on the needs of the individual or the family at that time. This program provides basically a grant up to $2,000 that could be available, and this program is highly utilized and demanded, and therefore we use a random selection process in order to identify the people that would be able to access the funding. We do this based on what we call rounds. So there's 2 rounds that we offer during the course of the year. The first round is May to June. The second round is July to October. We have additional information on our website, so there's a link here for you to look at that would include kind of the application process and information related to providers that administer the program on our behalf, such as the Maryland Community Connections. So we're excited about the opportunity of first round coming up. We hope you'll consider this program. So let's start to talk about the DDA application process. So here's an at a glance kind of flow of how the application process goes, and we'll get a little bit more details in the subsequent slides. But in general, first, an individual can contact the DDA by calling the regional office, or they can submit an application to the DDA. The regional office would then, based on that information and interest in applying for services, would assign a coordinator of community services, which is an agency that provides case management and technical assistance to people who apply for our services. The CCS would perform a face-to-face assessment. In other words, they will be meeting with the individual and the family to gather information, get to know them a little bit more, identify their needs, go through the application process. Based on that, that information is submitted to the regional office with any supporting documentation, such as psychological assessments, maybe an individual educational plan and such. The regional office would then review that application packet to make a determination related to DDA's eligibility and priority categories that we'll talk about. If in the event that we need some additional professional consultation related to the applicant to determine that eligibility, we could seek consultation from another professional to help us in that determination. But after the determination is made, the DDA would then be notifying the individual and their representatives. And included in that notification letter would be our determination related to eligibility and priority category. In addition, we will share information about the applicant's right to request a reconsideration, to request a case resolution conference, or to request a Medicaid fair hearing if they disagree with our decision. So let's talk about that application process a little bit more. In order to be determined by DDA whether a person is eligible for services, again, the person can contact us or someone on behalf can contact us, and then that application would need to be completed. Our application title is the DDA application for eligibility. It can be downloaded from our website, and we've noted the link here on this slide. In addition, if you contact the regional office, we're happy to mail it to you. If you want to stop by the regional office, we're obviously happy to share that with you too. Once we received an interest in applying for services, whether you contacted the regional office or you submit that application, the DDA or a representative, such as the coordinator of community services, will reach out to you and contact you to schedule an interview, that face-to-face meeting, at a time that's convenient for you. This could be during the day. It could also be during the early evening. So it's based on your needs and your preferences. After completing that application process, we will be sending you a letter related to your eligibility status. And in that letter, it'll also include that information related to our priority categories that you've been found eligible for that we'll talk about in the upcoming slides. As I mentioned before in that at a glance, if you feel that you've not been placed in the proper eligibility priority category, or if you were determined not eligible for the DDA services, our letter will also include additional information about the request for a reconsideration, where you can submit additional new information to DDA to consider related to your eligibility and our determination. You can request a case resolution conference, which is an opportunity to meet with an independent mediator to hear your position and why you feel that the decision was wrong, who would then issue a finding related to it. And you also have the opportunity to request a Medicaid fair hearing to go before a judge to state your case related to your position. One of the things we want to make sure that we emphasize is it's really important for you to keep the DDA updated on any changes in your circumstances or contact information. So for example, once you've been determined eligible and placed on the waiting list, if something were to change in your circumstances or your caregiver's circumstances, it's important to contact us because that could change your priority category on our waiting list. In addition, if your address or phone numbers or contact information changes, we need that so that we're able to reach out to you in the future with any other follow-up. We accept applications at any age and at any time of the person's lifespan. So as Patricia mentions, we serve the lifespan, and so we can take applications for toddlers up to people in their 80s or 90s. So age does not matter. We're open and want to support people. Our eligibility for services, again, does not necessarily mean that the DDA is able to provide funding to address your needs at that time. So you may be determined eligible for our services, but you may be placed on our waiting list until funding opportunities come available. This means that when the designated funding is available based on your priority category, we do serve people in the greatest need, and based on some other priority categories we'll talk about. At the time that it becomes available for you, that coordinator of community services would be informed, and they'll be reaching out to you to assist you in the next steps in regard to accessing services through the waiver programs. This is some information related to our regional offices. As Patricia mentioned, we have Central, Eastern, Southern, and Western noted here on this slide. This is specific information and contact numbers for the intake and eligibility unit. So if you're interested in applying for the services, you can contact the different office based on the county that you're being served. This is the application form, and we're going to try to open it here so that you could see. So when you click on that link, the application is available on our website. It is a form that you can fill out online and then print out, or you can print out and fill out that way too, and then you would submit it to the DDA regional office, for which we would then be able to assign that case management agency to support you. We're going to collect some information about the person, date of birth, the mailing address. We're going to ask questions about if other insurances that are available. Ask you to share some supporting documentation if that's available, other services you may be receiving and programs, and specific needs and diagnoses if you have that available. So this is just at a glance some of the things to include other programs or diagnoses. There's the medical things, the medical references. This is some information about some of the abilities that the person has and whether or not assistance is needed. This relates to communication, looking at services that may be needed related to that. The next area gets into personal skills. So you see we're looking at things related to eating, dressing, transferring, completing household tasks, and other items. This on part 3 is just giving us an indication if the person's applied or currently receiving or have received services in the past from a variety of different services and programs, because as we mentioned, there's many of them out there. These are other Medicaid programs. You'll see that the model waiver and the autism waiver is noted here, in addition to some of the other waiver programs that are available in the state of Maryland. And then the last section is authorization to request information and release so that we can look at that. So there's information that you would put in there and then signing off on that information. Section 5 is about the caregiver or guardian, so that's contact information related to them. So we'd get some basic information about demographics and how to contact and reach them. You'll notice that in that section, we're also going to ask for the age of the caregiver because we do prioritize people based on the eldest caregiver to support people who are living with elderly caregivers. Additional contacts can be provided if you have other contacts, and then we collect some statistical information for background information. And then the last section relates to the signatures. We're just going to go back to our slide. So we've talked about that application process. So we've applied, and now that application information is with the Developmental Disabilities Administration. So let's talk about the different eligibility categories that the DDA has. Based on Maryland law and statute and regulations, there are two eligibility categories for which we will be making determination. The first one is developmentally disabled. We refer to this as DD eligible. The second one is supports only. We refer to this as SO eligible. And obviously, if you don't meet either of those two categories, then we would issue a determination of not eligible. So let's talk a little bit about the developmentally disabled eligibility category. For this category to be determined, we wanted to note a couple important things. Individuals with a developmental disability diagnosis alone are not necessarily eligible for services under the Developmental Disabilities Administration. Eligibility, therefore, is not based on category or name of disability. There are specific criteria outlined in law that we have to make sure that are met in order for us to make that determination. So on the next slide, you see our different eligibility criteria. So for DD eligibility, there are 5 criteria that must be met. The first one is that the disability is attributable to a physical or mental impairment other than the sole diagnosis or mental illness or to a combination of mental and physical impairments. The second criteria is that the disability is manifested before the individual becomes 22 years old. This is because we are the Developmental Disabilities Administration, and therefore the disability must occur during the developmental stages. The third criteria is that the disability is likely to continue indefinitely. So we're not talking about short-term disability, it's a lifelong. The fourth criteria is that the disability results in an inability to live independently without external supports or continuing or regular assistance. And the last criteria is that the disability reflects the needs for a combination and sequence of special, interdisciplinary, or generic care, treatment, or other services that are individually planned and coordinated for the individual. For the fourth and fifth criteria, we utilize functional and adaptive assessments in order to make these determinations. Our other eligibility category is supports only. For supports only, you'll see on the slide that there's only 2 criteria that needs to be met in order to be found eligible under supports only. The first one, again, being that the disability is attributed to a physical or mental impairment other than the sole diagnosis of mental illness, and that this disability is likely to continue indefinitely. So now let's talk a little bit about DDA's priority categories. So based on an applicant's application, we'll determine whether they're DD, developmentally disabled, or supports only, and then we will also prioritize people based on the criteria that's listed here on priority categories listed in Maryland law and regulation. The top priority, for which we would use funding first, is referred to as crisis resolution. Crisis resolution is a situation where the person is in a crisis or an emergency situation now. For example, that would be people abused, neglect, homeless, danger to self, danger to others. The second criteria is our crisis prevention. And for people in this category, the person is or will be in a health or safety crisis, as we mentioned for resolution, within the year. So these are people at risk of those bad situations. Our third category is current request. Current request is for people who need or want services, but there are no health or safety needs identified or within the next year. So these are people who may want help in getting a job or may need some assistive technology but are not in crisis or at risk. So let's talk a little bit about that determination and notices that are given. So once we make our determination, the person would receive a notice, a letter, and the letter could state that the person is eligible for DD services, funding, or the developmental disabled, or supports only. That would include an approval letter noting the specific eligibility category with the priority status and information about being placed on the DDA waiting list. Or the person could be found not eligible for either the full DD services funding or supports only. In that case, they also have that denial letter with an appeal rights. And as we mentioned earlier, at any time you can ask for reconsideration by submitting a form with additional new information. You can ask for a case resolution conference if you disagree with our determination, or ask for a Medicaid fair hearing. So let's talk a little bit about DDA's funding priorities that allow us to move people forward towards our services. So DDA is allocated in our budget yearly dedicated funding for different types of priorities. Some of them are listed here on this slide. So the first one is emergencies, and emergencies are for people completely unknown to DDA. This would be, for example, a situation where maybe someone is dropped off at a hospital and there's no family members or caregivers available to support them. And so this person being completely unknown to us is in a crisis or emergency status. We would immediately go out to determine eligibility and see what services we could use to support them. We also prioritize and have dedicated funding for people who are court involved. So these are people that are involved in the court system that have been determined eligible for community type services, and we would prioritize them and support them in the community versus having them go into the criminal justice system. We also prioritize people leaving an institution. So people in a nursing facility or a state residential center, we want to support them in returning to their communities and have prioritized them with dedicated funding. We also prioritize youth that are exiting the foster care system. There are youth and children with developmental disabilities in foster care system, and as they age out of that system, we want to support them if they have assessed needs related to their pursuit of the good life and trajectory. We also at times get funding dedicated to support our waiting list. So this provides opportunities for us to take people off our waiting list in those different categories that we mentioned. And we also prioritize and support transitioning youth that are exiting the school system at age 21. Each of our categories listed here and the other ones that we have noted in our programs have specific criteria that a person needs to meet in order for us to support them with funding. So as we're kind of concluding today's topic related to the DDA application and eligibility for services, this is an at-a-glance view of that process and some next steps that we'll be talking about in some upcoming webinars. So we reviewed that DDA application. Remember, you can contact the DDA regional office or submit an application at any time, at any age. When we get that information, we will assign that coordinator of community services that will go out and do what we refer to as a comprehensive assessment, see what your needs are, help you with that application process, and submit that information to the DDA regional office. The DDA regional office then does the eligibility determination, where we would, based on the information that was provided and supporting documentation, make a determination if the person meets the DD eligibility, the supports only eligibility, and also identify a priority category of crisis resolution, crisis prevention, or current request. Based on that, individuals that are found DD eligible on our waiting list will also have the opportunity to identify a coordinator of community services that can help them while they're on the waiting list, and so they would get the CCS assignment and choice form, and then the person is placed on the DDA waiting list. In our upcoming webinars, I believe in April, we'll start to talk about the waiver application process, which then we would talk about waive funding placement, the waiver packet, authorization, enrollment into the program, and then service implementation.
So this is our contact information. However, we'd like you to contact the regional offices who can best provide you with the immediate support and assistance to complete the application. We're keeping this webinars very short, so it's your lunchtime. It's a brown bag lunch, so hopefully you're meeting with other people, having lunch together, or being very laid back. We are now going to opening for any kind of questions that you may have in reference to the DDA eligibility and application process. So I'm going to read the questions, and then we hopefully respond. If there's any regional staff on the phone, if you online, if you want to respond, that's fine too. And then we'll just make sure, let us know, and then we'll get specific to a region, and we can open the line for you to speak. So I'm going to start with questions. Can you clarify the transitioning youth age of 21 requirement? What is the time frame for that? For example, is a youth adult who is graduating in June at the age of 20 but will be 21 in September going to be eligible for transitioning youth funding?
So that's a great question, and the answer to your question is yes. So our eligibility is that 20 to 21 time frame, and so typically what happens is students will transition or graduate in a sense at 20 to 21 years of age. They finish school in June. Based on that, we would help with the application process if they're identified as a transitioning youth, so that services could begin as early as July 1st.
How can we assess the link for future references? You can actually download the presentation right now. We also are recording this, and we'll put it on our website at the end of the week under our webinars and trainings. Are there preferred functional or adaptive assessment that the DA likes to see?
So there are a variety of different adaptive and functional assessments. We have worked with national consultants and had some recommendations related to 3 specific assessments that we could provide additional information about, but we would work with the individual and the families related to information that's available. I also want to note that at times we have people that apply that have been with their caregivers or families for years. They may not have some of the assessments available to them or school records. And in those situations, the GDA works with the individual and the families and will interview people that are known to them to help to make those determinations.
Is there an age that CCSs are typically assigned by?
No. CCSs or coordinators of community services are not necessarily assigned by age of the applicant.
What is the turnaround time when applying for services and receiving a determination?
So that's a great question. So and generally it's about a 45-day process, but a lot of that depends on the information that we receive. In other words, if we receive the application with the supporting documents that has all the information in it that we can make our determination, that can be done quickly. If it's missing some information or we don't have enough information to make that determination, we may ask some questions and request additional information if available before we can make that determination.
If a student turns 21 in March, will funding stop before the end of the school year?
That's another good question related to transitioning youth. So the funding related to school services, let's talk about first. When a student turns 21 in March, they can continue their education through the end of that school year. So most likely all the schools end in June. Our transitioning youth funding, if the person was eligible, would begin July 1st. Once a person is enrolled in a DDA waiver program, as long as they continue to meet that waiver program eligibility, they will continue to receive funding for services throughout their life based on assessed need.
I am working with a social worker at a county DSS, and she said that the Social Security Administrator doesn't provide them with a Social Security card. Can I submit the DD application without the Social Security card?
Yes, you can submit it without the Social Security card.
Is the autism waiver available to adults or is it only available to students?
So that's another great question. First, I just want to clarify that the Developmental Disabilities Administration does not administer or oversee the autism waiver. It is administered in day-to-day operations by the Maryland State Department of Education, and this program is designed for children up to the age of 21.
Where can we get the info on assessments?
We will be happy to share that with the list of the 3 assessments that were recommended to us as a follow-up to the webinar for those who've registered.
For students still in school, is there a time frame that is recommended for starting the application process?
Another great question. So first of all, in terms of DDA application process, so this is just to be determined eligible under DDA's eligibility criteria or categories, we recommend that you start that process as soon as possible. For youth transitioning and considering that, it should be done by age 14, but again, you can do it today. So if you got someone that's 21, you can do it today. But people apply at all ages. So we have people apply with children to 6 years old up to people in their 50s, 60s, 70s. So you can apply at any time.
We applied to DDA when my son was 14 and got a preliminary assessment. I was told to contact DDA to let them know he is getting closer to being in a transition state. I'm not sure what I am supposed to tell DDA.
So that's a great question. So some people apply to DDA and they're found eligible for services but may not have a need right now currently. If you don't have a need within the next 3 years for a service because maybe your supports are being provided through the public education or special education system, then people are placed on our future needs registry. And so what I'm anticipating is that you may be on the future needs registry, and for which when you are getting closer to that transitioning time to get exiting the school system, which is maybe at age 18, that they're saying, hey, get back in touch with us unless you've got a different change in your circumstances. If you're unsure, I encourage you to contact the DDA regional office. They can look up your information and provide additional information and guidance for you.
Where is the presentation which can be downloaded? So if you look at your screen, if you're on the computer, there'll be a section that'll say webcam, audio, dashboard. They're under Hangouts. There's a little icon that says applying for DDA services. Click on that and that's how you can download it. If you need more assistance, let us know. We'll be glad to walk you through this again. So why is age 14 the benchmark for applying?
So age 14, just to clarify, is a good benchmark for transitioning planning. As I mentioned before, you can apply at any age. So if you think or know someone who may be eligible or interested in pursuing DDA services, we encourage them to apply now today. The age 14 was in reference to transition planning, so if you have not already applied to the DDA, then we really want people to start thinking about transitioning, meaning transitioning out of the public education system towards the adult service delivery system or post-secondary education by age 14. But again, if you're 16, 17, 18, you still have time. Just get in touch with the regional office.
What services are available for a child on the DDA wait list who graduates at 18 with a high school diploma but not eligible for transition youth priority until age 21?
So that's a great question. The transitioning youth priority category is in Maryland regulations, which has a criteria related to the age of 21. Therefore, if a student or youth graduates at age 18 with a high school diploma, we are unable to support them under that priority category. We do have a community supports waiver and another waiver program that if the person was on the waiting list in the group that we're able to access the funding based on the highest priority, then they may have an opportunity to access services at that time. It would be separate from the transitioning youth funding priority.
If a student submits an application but has not had updated cognitive and adaptive assessments in the previous 3 years because the school system will not provide them, will DDA still consider their application?
Absolutely, we'll consider their application, the information.
Do I need to register each week for the seminars? No. Once you have that link, you can just open that link at the same time, and then you should be able to join us. Our son is 22 now and is not receiving DDA services, although he has received services from DOORS previously and from public schools when he was in first and, I'm sorry, I lost track. Sorry, it just moved on me. Before being moved to a private school for kids with special needs. It has become clear since graduating from high school that he is not as high functioning as everyone, teachers, parents, etc., had hoped, and may not ever be able to live fully independently. Is it too late to apply for DDA eligibility for him? What proof will we need to present to show that he has diagnosed well prior to the age of 21? What sort of services might he be eligible for at his age?
So that's a great question, and I'm going to share a few thoughts related to that, but I want to encourage everybody on the phone, because we all have individuals with unique needs and different types of stories or situations, to definitely reach out to the regional office that can provide you specific assistance and advice related to your individual needs. So we want to encourage you to do that. But yes, at any time you can apply to DDA. It doesn't matter what age you're at. We will look at what information is available, the assessments that are available, previous school records, you know, professional, psychological, psychiatrical, medical assessments to help us make a determination of that need. So you could look at that. Based on that, if the person's determined eligible, they would be placed on the waiting list unless they met one of our funding priority categories and was at the top of the list for those that are eligible. We'll talk about those processes in the upcoming webinar series.
Okay, so that brings us a little closer to 1 o'clock. Is there any other questions that you guys may have or that you would like to share with us, so that we can see if we can be of any assistance or support? We would love to hear from you.
So there was a question about not seeing the presentation, and we're happy to send that out to all the registered guests.
Those of you who actually put that in the question, Donna, Will, who did our introduction, is sending it to you via an email. On the first bullet of the eligibility criteria, can an individual with a combination of mental and physical impairment be found eligible? The comma makes it confusing on the first bullet of the eligibility criteria. Can an individual with a combination of mental and physical be found eligible?
The answer is yes.
Lots of people are saying thank you so much for providing this session. Thank you for joining us. We really do appreciate it. And if you have any specific topics you'd like to hear about, let us know, because we're hoping to start a trend and have these brown bag lunches on a regular basis. Is it possible for students to be eligible for DDA services but not eligible for waiver services?
So the answer to that question is yes. People who are DD eligible for meet the developmental disabled eligibility criteria for DDA will meet one of 3 criteria associated with the waiver application process that we'll talk about in April. People who are supports only or SO eligible would not meet the waiver criteria.
How critical is it to have current assessments or assessments after 18 admissible?
So it's important to have, you know, information related to the individual's adaptive, functional, and background history. Again, I would just contact the DDA regional office, go through the application process, submit the information that is available, and if we need additional information or unable to make a determination, then we'll let you know related to that. But without seeing the information, it's hard for us to provide any guidance.
I was instructed by someone at the regional office to call the police every time my son scratches me so we can change him to critical. Do you recommend calling the police as proof of critical needs?
The answer to that is no. I would contact the regional office and talk with the director about your concerns related to that so that we can further get additional information and look into that.
This is a great way to get information to families directly for DDA. Looking forward to more. Thank you so much. We're hoping that we can deliver. I have a question. I have a cognitive disability, and I'm in the new waiver. How do I get a hold of the offices? Because I have a question.
So that's a great question. We can go back to the slide that shows the regional office contact numbers, and then we'll put that on the screen for the regional office directors so that you can have that number for you to call and get in touch with them.
Okay. What type of doctor would be best for providing the documentation you need for the application?
So generally, functional adaptive assessments are completed by psychiatrists, but again, we are open to reviewing any information that's available and submitted with your application.
How does an individual's Medicaid status affect their DDA funds?
So that's a great question. I'm not sure that I understand fully maybe what you're trying to ask, but individuals' Medicaid status affect the DDA funds. So a person can be DDA eligible and DDA services and not receive Medicaid, and individuals can be in our DDA waiver programs in the sense that when you're in the waiver program, you receive funding under the Medicaid authority for the waiver, but you're also eligible for Medicaid state plan services.
Okay. And we want our son to live near a sibling or family as his parents. This is a follow-up question to another, but I can't find it.
So again, I just encourage you, if you have individual specific questions, to reach out to the regional office, and that way you can have a dialogue and provide additional background and information in order for them to provide assistance.
What is DDA doing to reach out to the homeschooling population with developmental disabilities?
So that's a great question. We do a lot of partnerships with different groups and individuals to include stakeholders from various representation and local school systems transitioning coordinators and such. We're open to any additional contacts that can be provided. We also partner with advocacy organizations such as the Developmental Disabilities Council, the ARC of Maryland. We work with the Maryland Department of Disabilities and others. So if anybody were to come in contact with them seeking services, they also share information about our services. Again, if you have some suggestions about ways that we can increase outreach to these groups, we are happy to look into that and support.
Okay, any additional questions? Okay, so I don't see anything else on our screen, and we promise we're going to be respectful of your time. So we'll wait a few minutes if there's any more questions. Here's one more. Don't transitional youth eligible students need Medicaid?
So that's a great question, and we'll talk a little bit more about Medicaid and the application process when we talk about the waiver programs. To apply to DDA, you do not need to have Medicaid. You do not need to be Medicaid eligible. But you should apply to DDA. We can determine your eligibility for our criteria. The next step in the process would be an application for our waiver programs if you're in the priority categories that have designated funding available and at the top of the list. But youth do not need to be eligible and have Medicaid funding in order to apply for services.
Okay. All right, so let me just give you a little bit. Our March 26th webinar is going to be about person-centered planning tools and strategies. We're going to talk a little bit about the different strategies using the integrated STAR, using maps, future planning, and we're going to talk a little bit about how did you as a parent or as a person in services or as a provider use those tools to create innovative service delivery, and also to be very informed about expectations of how the person-centered plannings are developed within in Maryland, and some of the expectations. So that's going to be the 26th, and then April 2nd, we're going to actually do go over the person-centered plan authorization process. What does that mean? That means we're going to tell you how does DDA approve a service and authorizes it, and what needs to be in place for that services to be approved. So that should be a really interesting one. And then April 16th, we're going to talk about self-directive services. And then on the 23rd, employment and meaningful day. And on the 30th, behavior support services. So we'll continue to add different topics based on interest and based on what we get from previous webinars, so that we can increase and keep that dialogue with you all in the community, so that we can make sure that we're reaching out people and informing folks about what we do in our services. All right, I'm going to read one last question, and then we'll end our webinar. As I have.
Someone's taking that class.
Oh, someone's taking this class. Okay. I think everybody's saying thank you so much. Very helpful for the information. Looking forward to other webinars. We are too, and thank you so much. I really appreciate you engaging with us today. I'm happy to say that we had over 260 people join us. So really thank you for taking your time, your lunch time, to join us, and have a wonderful week. Thank you.